May I come in?
Yes, you may.
Thank you. So my name is Amy. I'm going to be the nurse taking care of you today. I'm going to pull this for some privacy.
Thank you.
And we're going to do a head-to-toe physical exam. Should take about 15 to 20 minutes. I want you to stop me if you have any questions. Okay? All right. Thank you. So first thing I'm going to do is verify you are who you say you are. Can you tell me what your name is?
Annie Ryan.
Great. And what's your date of birth?
10/3 of 84.
Great. Thank you. Can you tell me where you are today?
Chamberlain Hospital.
Perfect. And do you know what the month is?
It is March.
March. Perfect. Are you in any pain today?
Not right now.
Okay, great. So my patient is dressed appropriately for the weather. She appears to have bathed recently. She's well nourished. She's maintaining eye contact. She's relaxed. She doesn't say that she's in any pain. She's alert and oriented, times 3, and is making eye contact and smiling and answering questions very quickly. So the first thing I'm going to do is I'm going to go ahead and take your apical pulse, and I'm also going to take a respiratory rate. So I'm just going to place my stethoscope under your shirt. Sorry, my hips are kind of full. I will say that a full 60 seconds has gone back and that her pulse rate is within normal limits. I'm going to go ahead and take a respiratory rate. So I'm just watching her chest rise and fall for 30 seconds and then multiplying by 2. Her respiratory rate is within normal limits. The next thing I'm going to do is a skin exam. So I'm just going to go ahead and put out her forearms. So my patient's skin tone is even throughout. It's appropriate for race. She does have a couple of small little nevi. Any changes to these? No. Have they been there forever?
Yeah.
Basically? Yeah. So my patient's skin is warm to the touch, intact. Her nails are clean. They are not chipped. They are smooth. Her capillary refill is less than 2 seconds. And my patient's skin turgor is excellent with quick elastic recoil and mobility. You can put your arms down. All right, so the next thing I'm going to do is palpate your head. So I'm going to touch your head. So my patient's head is normocephalic. It is symmetrical. Why don't you tell me if you feel any pain when I do this? Good. Any pain when I press here? No. Good. Any pain when I press here? No. Okay, I'm going to palpate your lymph nodes at this point. So pre-auricular, post-auricular, occipital, posterior cervical, tonsillar, submandibular, submental, deep cervical chain, superficial cervical chain, and then trigger shoulder tree. That's supraclavicular. So no palpable lymph nodes. Any pain when I did any of that? No. Okay, great. So the next thing I want to do is go ahead and test your range of motion. So I'm going to have you look to the right. Good. Now look to the left. Perfect. Look up, and then look down. Good. I want you to drop your right ear to your right shoulder, your left ear to your left shoulder. Go ahead and shrug your shoulders to me. Good. So now I'm going to have you do all that against resistance. I'm going to place my hand on either side of your head and do the same thing. So move your head to the right. Good. To the left. Good. Up. Good. Down. Good. Go ahead and shrug your shoulders. Perfect. So full range of motion, strength against resistance, cranial nerve number 11 is intact. All right, so the next thing that I want to go ahead and do is test your eyes. So I've got this pen light here. I want you to just look straight ahead at me. So my patient's eyes are symmetric. Her eyelashes curl up and away. Her eyebrows and her eyelashes are free of any lesions or infestations. Keep looking straight at me. I'm going to go ahead and just shine a light. Beautiful. Good. Now I want you to follow this pen light. Good. So Perla is intact. Cranial nerves 3, 4, and 6 are intact, but I'm going to check extraocular movements. I want you to just follow my pen light while keeping your head still. Good. So extraocular movements are smooth and coordinated. No strabismus, no nystagmus. Cranial nerves 2, 3, 4, and 6 are all intact. All right, so now I'm actually going to hold on to this and look inside your ear. So I want you to let me know if you feel any pain when I do this. No pain. Any pain when I do this? No pain. All right, so your other ear, let's see. Any pain when I do this? No pain. Good. Any pain when I do this? No. Good. Any difficulty hearing me at any point? No. Great. Any hearing complaints? Any other? Okay, perfect. So no pain, no discharge, no redness, no infestations. Cranial nerve number 8 is intact. All right, so the next thing I'm going to do is assess your nose. So your nose is symmetrical, it's midline. I want you to go ahead and take a deep breath in for me. Good. Other side, take a deep breath in for me. Good. And then I'm going to look inside with my pen light, just look up at the ceiling. Perfect. So her nares are patent bilaterally. The patient's nose is symmetrical, and I see no lesions, redness, discharge, or growths interior. All right, so the next thing I'm going to do is look at your teeth and your gums. So go ahead and just open up your mouth for me. Perfect. And I want you to go ahead and say ah. Ah. Beautiful. You go ahead and close your mouth. So my patient's lips, teeth are intact. Her lips, her gums, her buccal mucosa, her posterior pharyngeal wall, and her uvula are all pink and mucoid and free of any lesions. Uvula rises with phonation. There's no pooling of secretions. Cranial nerves number 9 and 10 are intact. So the next thing I'm going to do is look at your respiratory system. So the first thing I'm going to do is inspect your thoracic cavity. My patient's costal angle is roughly at 90 degrees. Her anterior posterior is half that of her transverse diameter. So I'm going to go ahead and palpate your chest wall. Every time that I touch your back, I want you to say the phrase blue moon. Blue moon, blue moon, blue moon, blue moon, blue moon, blue moon. Beautiful. So there is equal vibrations heard throughout for tactile fremitus. The next thing I'm going to do is auscultate. I'm going to auscultate your anterior portion of your chest wall and then followed by your posterior. So just go ahead and breathe normally for me. Okay, have you lift up your right arm? Good. Stay there. I'm just going to walk around to the back of the bed. I'm going to reach down your shirt first before I lift up. Clear vesicular lung sounds are heard throughout. My patient is breathing room air. She has no cough and no complaints. So the next thing I'm going to do is inspect your cardiovascular system. So looking at my patient's neck, there's no jugular vein distension. And then I'm going to palpate your carotid arteries one side at a time. Beautiful. Good. Carotid artery is a +2 bilateral. Looking at her chest wall, it's free of lesions. It's free of any heaves. I'm going to palpate for any chest thrills. I feel no vibrations. And then I'm going to go ahead and I'm going to listen to her apical pulse. Just one more time, just listening for regular rate and rhythm. Good, so regular rate and rhythm. I'm now going to listen to the 5 oscillatory areas. So I've got aortic, pulmonic, Erb's point, reach up and under, that's how I do it, tricuspid, and mitral. I'm going to turn my stethoscope and listen with the bell, the same areas, aortic, pulmonic, Erb's point, tricuspid, and mitral. Good. So no extra heart sounds, no murmurs, no S1 and S2 are heard in the appropriate locations, no S3 and no S4. So the next thing I'm going to do is I'm going to look at your gastrointestinal system, at your abdomen. So if you could just lay flat for me. Good. So I'm going to lift your shirt up. Thank you. So the first thing I'm going to do is inspect. My patient has a lovely scaphoid appearance. She's symmetrical. I don't see any Lifts, I do see a little bit of a pulsation where her aortic abdominal pulse is present. I don't see any pulsations in her gastrointestinal system. So the next thing that I'm going to do is auscultate. So first I'm going to auscultate for an abdominal aortic bruit, utilizing the bell of my stethoscope. No bruit is present. And then I'm going to auscultate all 4 quadrants with my diaphragm of my stethoscope, listening 2 to 3 locations. In each quadrant. All right, bowel sounds are present in all 4 quadrants. They're normal active. Now I'm going to go ahead and palpate lightly. I just want you to let me know if you have any pain when I touch. Okay. Good. So no abnormalities present when I palpate for skin surface and musculature. I'm going to go ahead and help you sit up because we're done with you laying down. And then what I'm actually going to have you do is stand up and face me. Over here. Perfect. So I'm going to test your range of motion of your shoulder, your elbow, your wrist, your hip, your knee, and your ankle. You ready? All right. I'm going to take off my stethoscope so it doesn't get in the way. So what I want you to do is salute a soldier. Good. With the other arm. Perfect. Now, arms out, walk like a zombie. Good. Fly like Superman. Fly like an airplane. Comb your hair. Pat your back. And pitch a softball. Good. Other arm. Pitch a softball. Beautiful. Now, what I want you to do is go ahead and put your arms out, put your palms up, put your palms down. Good. And then go ahead and bend your arms in. Now, I want you to put your arms straight out. One more time. Lift your arms up. Good. And then pull them down. Good. Go ahead and bend your elbow for me. You bring your arm into your base. Good. And bring it out towards me. Good. Other side. I want to do the exact same thing. Bring your arm in and then out. Good. Go ahead and flex your wrist like this and then down and then up and then a little no way Jose. Perfect. Now put your hands up against mine. I want you to push like you're pushing on a gas pedal. Beautiful. Now pull back. Good. Perfect. So full range of motion, strength against resistance to the shoulder, the elbow, and the wrist bilaterally. Now for your hip. So what I want you to do is go ahead and kick a soccer ball. You're kind of getting like a right. There you go. Other kick. Very beautiful. And then kick a big rubber ball, like you're really wailing it across the playground. Good. Perfect. All right. Now I want you to go ahead and bring your knee up and bring your foot in and then bring your foot out. All right. Other foot. Knee up, in, out. Beautiful. I want you to have a seat for me on the bed, and I'm going to test the strength of those same joints. So what I'm going to have you do first is bring your knees out. Good. And now bring your knees in. Squeeze. Perfect. Now bring your feet up towards me. Bring your whole leg out straight. Now, it was what I said. Then bring them back. Good. Now I want you to just point your toes towards the sky. Good. And now towards the ground. And then I want you to kind of point them towards the sky against me and then down towards the ground. Oh, beautiful. So full range of motion, strength against resistance to the hip, the knee, and the ankle bilaterally. All right. So the next thing I'm going to do is palpate your dorsalis pedis pulse. You can just stay where you are.
Shoulder and elbow too.
Good. Dorsalis pedis pulse are 2+ bilaterally. All right, so I did the shoulder and the elbow.
You just didn't verbalize it.
Yeah.
Shoulder and elbow and wrist.
+5 muscle strength. Shoulder, the elbow, the wrist, the hip, the knee, and the ankle. All right, so the next thing I want to do is assess the cranial nerves that we might not have assessed. So, do you have any issues with smell?
No.
Anything abnormal recently? Do you know, like you can smell normal smells?
Yes.
Great. So cranial nerve number 1 is intact. We already tested 2, 3, 4, and 6 by testing using Perla and 6 cardinal fields of gaze. For cranial nerve number 5, I want you to close your eyes for me. I want you to tell me when you can feel me touch. Just say now.
No. No. No.
Good. Now I'm going to place my hands on either side of your ear. I want you to open your jaw. Close your jaw. Perfect. Cranial nerve number 5 is intact. Go ahead and smile. Frown. Puff out your cheeks. Close your eyes tightly. Good. Cranial nerve number 7 is intact. I know the patient can hear me because she is following commands appropriately. Cranial nerve number 8 is intact. Uvula rose with phonation earlier. 9 and 10 were intact. There was no issue with any cervical range of motion, strong against resistance. Cranial nerve 11 was intact. And then what I want you to do is say the phrase light, tight, dynamite. Light, tight, dynamite. Beautiful. Cranial nerve number 12 is intact. All right, so the next thing that I'm going to do is I am going to assess your motor reflexes. So what I want you to do is just stand up straight for me. Good. Put your feet together, arms at either side, and I want you to close your eyes. Good. Negative Romberg test. Now have a seat for me again. Stand up and sit down. Good. Now I want you to just follow me. Put your palms up, palms down, palms up, palms down. Faster, 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 faster. Good. So negative Romberg test. Patient is able to perform rapid alternating movements. The next thing I'm going to do is I'm going to test 2-point discrimination. So I want you to give me your lovely forearm and close your eyes. And every time I touch you, I want you to tell me if I'm touching you with 1 point or 2 points.
2, 2, 1, 1, 2, 1.
Good. The patient is absolutely normal as far as 2-point discrimination. Sorry, kidding. So now I'm going to test deep tendon reflexes. Okay. So the first one I'm going to do is the bicep reflex. I want you to just relax and let me hold your arm. Right thumb is placed on your tendon. Just hang out here. All right, so I want you to go ahead and make a fist with that hand over and over again. Fist, open, close, open, close, open, close, open, close. Good. So let's do the other arm. Good. So let's go ahead and do the tricep reflex. So just let me hold your arm completely. Good. Other arm. Good. Bicep and tricep reflexes were 2+ bilaterally. Now brachioradialis. Yeah, I'm going to basically hold your arm entirely. You can even rest it down here a little bit. Good. Right, go ahead and stop looking at me. Look over there. There we go. Good. So brachioradialis are 2+ bilaterally. Uncross your leg spine. Good. I want you to move kind of off the bed a little bit. There you go. Good. So patellar or quadricep reflex is +2 bilaterally. I'm going to do something a little funny, okay? I'm going to have you flip over on the bed and get up on the bed on all fours. Good. Good. Achilles reflex is 2+ bilaterally. You can turn around and sit down for me. Okay, so do you have any pain after going through any of that?
No pain.
Good. Any questions for me at all?
No, ma'am.
Okay, I'm just going to go ahead and perform some hand hygiene. Is there anything else I can do for you before I leave?
No, thank you.
Okay, great. Thank you so much. I'm going to bring your bed down to a lower height just for safety.
All right.
But thank you so much. Have a great day. Same.